Assalamu alaikum, this is Shama and now this is a video. In the previous video we have discussed that how the hypokalemia it affects the excitable tissues of the body, and now we are going to see that out of all the effects that are caused on the cardiac muscles, how will they appear on ECG, and what will be the ECG of a patient of hypokalemia be like. Okay, so first of all, my first important point is that potassium it is important for the repolarization phase, means this T wave that represent ventricular repolarization, that is important. Potassium is important here. So first point, first of all, this is the normal ECG, normal P wave, QRS complex, this is the T wave and so on. So this is the normal ECG in which the potassium ions were normal 3.5 to 5 milli equivalent per liter. So this is the normal value. But now what happens is that hypokalemia has generated. When hypokalemia generate, first of all there is slight you can say that P wave amplitude will increase. P wave amplitude, this slight P wave amplitude will increase, and PR interval will be increased. Just you can say not initially, but PR interval will be normal. In third phase it will increase. First of all, what happens is that the T wave, they will be flattening. Now this T wave will become, since there is less potassium, so there will be T wave flattening seen and a U wave will appear. So first change that is seen is that U wave will appear and there is T wave flattening progressively seen. In the second, and yes, because of this T and U wave now appearing, and U wave is now becoming more and more prominent, and this more and more flatten in the progressive series, so it will appear the same. So QT interval will start to become prolonged. Fine, and these are occurring when the level of potassium ions it is now less than 3 milli equivalents per liter. Moving on to the third, what will happen that P wave will be slightly raised. First is that P wave will be slightly raised, PR interval not much, just slightly increase. I make a short arrow. Main effects will be that QRS, the QT interval will become more prolonged, and that is the more prominent finding. Plus now T wave has further flattened, and the U wave has become more prominent. And all these are occurring when the potassium levels become now less than 2 milli equivalents per liter. Now further progressing, what will happen that now what will be the change that the ST segment will also be depressed. So there will be depression of the ST segment, plus T wave now becoming flattened. Ultimately in severe state the T wave inverts, and there will be a very prominent U wave that will be seen. And of course this U wave has a whole superimposed the T and this very long QT interval prolongation will be seen. So these are the basic features that are seen on the ECG. Now and these all occur when the potassium ions further become less than or equal, I think equal to 1 milli equivalent per liter. So yes, these are the whole ECG changes that are seen in a patient with hypokalemia. What are U waves showing? U waves are showing basically they show repolarization of the Purkinje fibers. Normally U waves are not seen, but here they are seen. Why? If you have seen my previous video, I have shown that Purkinje fiber is now acting at a more rapid rate, its excitability is increased. So that may be a reason of appearance of U wave more prominent and T wave progressively flattening down. Fine. So again, just now I have explained you the whole whole mechanism also and whole ECG that will appear. Now a quick recall in just memorizing the hypokalemia ECG in 1 minute. How you'll memorize it? First of all, there is hypokalemia, means low level of potassium in the blood. When there is low level of potassium in the blood, means the major factor that will be affected will be ventricular repolarization, means the T wave will be affected. So low potassium, decrease T wave, low potassium, decrease T wave. Remember it, low potassium, decrease T wave. So as potassium is decreasing, T wave first become flattens, then further flattens, further move down, ST segment will take along it depressed, and T wave will become inverted. So this is the whole changes in the T wave. Along with it, its activity is being replaced by the U wave. First U wave will appear, then become more prominent and more prominent. Second phase to remember. Thirdly, since now in addition to T wave, an other wave called the U wave has appeared, and which is superimposing the T wave, so the QT interval will now become prolonged. So this is the whole basic theme by which you can easily recall what is the most basic findings of a patient whose ECG we are seeing of hypokalemia. So thank you very much. This is the whole video on hypokalemia, and I hope you liked the video. If you did, then like, share and subscribe my channel, and keep supporting. Allah Hafiz. See you in the next video.